Hello, everyone, and welcome to the Evidence-Based Practice Continuing Education Opportunity entitled Lower Limb Preventative Training Program Best Practice and Implementation. Our three primary learning objectives today will be to first, discuss the current state of evidence for preventative training programs. Next, we will describe the 7-step framework for successful preventative training program design and development by going through a framework developed by Padua and colleagues. And lastly, we will prepare strategies for implementation in different sport-specific or setting-specific scenarios. To address our first learning objective, let's first review some of the evidence. When we think about lower extremity injuries broadly and the impact of injury, say from an anterior cruciate ligament or ACL tear, the consequences can be quite costly. And cost can mean a financial burden for the patient to pay for care and treatment, but it can also be the social burden associated with time spent in surgery, time spent in rehabilitation, as well as any other quality of life changes experienced by the patient. So these injuries are not only costly in the short term, but they also have long-term financial and personal costs. Then, if we consider lower extremity injuries about the knee, there's a high risk of the patient developing knee osteoarthritis. Specifically looking at ACL injuries, there's evidence indicating that a patient will develop knee OA within 10 to 15 years. For those who may work in a secondary school setting or perhaps with an even younger patient population, think about the 14-year-old who tears their ACL. They're likely going to develop knee OA in their mid to late 20s. This can have huge consequences when we think about the timelines from the perspectives of a young athlete. So what can we do about it? While we can't prevent every injury from occurring, there are different levels of prevention where clinicians can intervene. Primary prevention occurs when the injury is prevented before the event even occurs. This would be the most ideal scenario. For secondary prevention, the injury has already happened, but we make efforts to reduce the impact that the injury will have. In our example of knee osteoarthritis, this may involve regular visits to a healthcare provider in order to monitor and screen for the condition at its earliest stages. And finally, there's tertiary prevention, where the goal is to reduce the impact of the injury's lasting effects. For knee osteoarthritis, this may mean physical rehabilitation or other measures to slow the acceleration of the condition. Here's another example of the levels of prevention, but with a bit of a visual. So I live in Arizona, and we have a Grand Canyon. And let's say our goal here is to prevent individuals from falling off of a cliff at the Grand Canyon. So our primary prevention efforts may involve installing a fence. This should prevent many individuals from getting too close to the edge and falling. However, the Instagram opportunities just aren't as great when you're standing behind a fence. So some people manage to go around the fence for a better view. Some of these individuals do fall off of the cliff. We can't prevent every injury. So our form of secondary prevention may be to have a net hanging. We couldn't prevent the fall, but we have a literal screen to help mitigate the impact compared to if the person were to fall the entire way. However, maintenance is expensive and our safety net is not foolproof, and while the net was able to slow the person down, they still fell. So our form of tertiary prevention may be to have an ambulance at the bottom of the cliff so that we can immediately transport the individual and provide the most expedient care possible. So now that we know that lower extremity injuries are problematic in the short term and problematic in the long term, fortunately there are methods we can apply at the different stages of prevention and different stages of the condition or injury to mitigate some of those negative side effects. So I'd like to draw your attention to the NATA position statement entitled Prevention of Anterior Cruciate Ligament Injury. And this position statement is quite recent. It goes into detail of the current evidence surrounding preventative training programs to reduce injury risk, reduce injury rate, and improve sport-related performance. This position statement also reviews the components and exercises that should be included in an ACL injury prevention training program. We'll review the evidence and program components within this EBP course, but this is a great reference to utilize following the completion of this course. Additionally, I just want to highlight another group with a mission similar to that of this EBP course. This is a publication from the Osteoarthritis Action Alliance Task Force, whose goal, again, is to prevent the onset of OA in people through effective injury prevention strategies. So their strategy is to promote widespread implementation of activity-specific rules and policies for organized sport, recreation, and school athletics to prevent joint injuries that can lead to OA. So just trying to address the different stages of prevention with different groups. And to highlight some of their efforts, this is an infographic that the Osteoarthritis Action Alliance Task Force released that just highlights the need for preventative training programs at different stages of prevention.